Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, June 28th. 2022, and we continue to join you weekly on Tuesdays at 11 to answer your COVID questions, other public health questions, and as always, you can put your questions directly into the box below on either Facebook or Twitter. You can also use the hashtag AskDrArwady. So related to COVID, we continue to update our dashboard daily, Mondays through Fridays. If we pull it up, chi.gov/COVID-. First, you'll note that we are back at a high risk level right now. We've been going between medium and high, and I'll show you some data on that in a second. But no signs of major concerns at all at this point. Cases are relatively flat compared to where they were a week ago. You see down just 3%. Hospitalizations also relatively flat. Deaths relatively flat, still averaging less than 1 per day. We're doing about 8,000 tests a day, and in that setting of not doing a lot of testing with CPS out of school, et cetera, our positivity rate is at 10.6%, but that's not of significant concern. And as a reminder, we don't use positivity when we're calculating risk. I also just want to remind you, because people continue to write in wondering how to find various things. So we've linked right underneath our main dashboard here to some of the things that we see people most often looking for. So if you want to see the most updated data on community risk and transmission levels, hospital capacity, which we actually continue to update 7 days a week, wastewater, variants, vaccine coverage, vaccine effectiveness, some of the social impact survey work we've done, our data portal where you can download data, or the Chicago Health Atlas, which is where you can not just look at COVID data, but all of the other health indicators for Chicago as well as other demographic information. So encourage you to explore that as you have interest. I do want to note that we likely will be doing an update to our COVID dashboard over the next week or two, just readjusting a little bit to put in some of the metrics that we're following more. And we won't take things down, but positivity, for example, may not be on that very first page anymore, just because it's less relevant given that most of the testing is happening in at-home tests and we have other ways to monitor. Whereas something like emergency department diagnoses, which continue to be very predictive, are something that we are following. We've seen just a little bit. Those are also flat to just a slight bit of an increase. And so we are going to be doing some refresh, and so don't be surprised if you see that. And obviously when we do that, we'll explain it in some detail on Facebook Live. I'm going to go ahead and pull up some slides here just to give you a little bit of a higher level view. So first of all, we've now crossed 12 billion COVID vaccine doses that have been administered across the world, which is pretty remarkable. We do continue to see a lot of cases, especially in Europe and in Australia, New Zealand, but very few severe outcomes in these highly vaccinated settings. If you look at the U.S., you see that the surge that's come with some of the Omicron recent subvariants has really ebbed in the Northeast, and we're still seeing a lot of the West, those darker orange areas, kind of getting through that small surge. Nationally, we're averaging 33 cases per 100,000 per day. Illinois is just under that at 29, and Chicago is just under that at 26. If we look at where right now the largest number of cases are being seen in the U.S., you'll see it's Puerto Rico, Alaska, Hawaii, California, Washington, Florida, etc. That's in red, but then in yellow and in gray, you see hospitalizations and deaths remain relatively low. And even in some of the places where we've seen some recent surges like Hawaii, that is coming down really nicely too. So no signs of major sort of uncontrolled surge anywhere in the U.S. at this point. 43% of U.S. counties are reporting a high or a medium COVID community level based on CDC national data. Cook County did edge back into the high level as of the update last Thursday evening and into Friday. And just as a reminder, CDC updates this map once a week, so we would see that formal move again Thursday evening or Friday. So our local risk is high because Chicago, of course, is part of Cook County. Cook County is part of the regional hospital data. And I do expect that we'll probably see some improvement. Let me just remind you, because we get questions about this a lot. How does the CDC calculate its COVID-19 community levels? There are three main metrics that they look at, and they look at these for every county across the U.S. So first is cases. How many new cases per 100,000 population over the last 7 days? Obviously, there's some caveats there in terms of are we testing enough and positivity. But by and large, the goal is to be less than 200 here. And you'll see the city of Chicago is well under that at 177. And all of Cook County, including the city of Chicago, is just a tiny bit over it at 202. And then new hospital admissions per 100,000 population. That's really not dependent on testing patterns. You see, the goal is to be less than 10. City of Chicago is low at 3.5, and then all of Cook County, which also includes actually some areas outside Cook County because of how the CDC looks at hospitalizations by region, is just over that goal of 10 at 10.2. And then finally, what percentage of our staffed inpatient hospital beds are being taken up by COVID patients? The goal is less than 10%, and you can see we're well under 4%. So I am expecting we'll see some improvement given that both of these are on the borderline. If either cases or hospital admissions drop back under their respective goals, Cook would go back to medium, and then if both drop under it, Cook would actually move to low. We continue to follow a lot of other metrics. We get this question a lot too. So just to give you a sense of some of this, we've defined low, medium, and high concern for a number of other metrics for Chicago. So for example, 2.1% right now of emergency department encounters across the city result in a COVID-19 diagnosis. That is low level of concern. When we look at our local wastewater sampling sites, we have 11 sites. We do sort of a 10-day rolling average, and if we're seeing that average double from the 2 weeks prior, we note that to be some concern. And so we have 2 sites now that are meeting that, which puts us in sort of a medium concern range. Our variant risk assessment locally is at medium, and our number of new outbreaks, new recent outbreaks, is at actually just 1 in senior, youth, and behavioral settings, which is low. So no major concerns. So as we move back to the high COVID community level based on these CDC metrics, what does this mean? Not that much. We did a press release about this on Friday. We'll continue to do regular, probably Tuesday and Friday, written releases just so folks know where we are. But given how close these metrics are to threshold, I expect over the next couple of weeks, we likely will see Cook County move back down. And the city, in fact, has already met the goal metrics. No new mandates or requirements at this time. Reminder, we absolutely would plan to reinstate new requirements, mandates, if our health system capacity were being threatened, which it is definitely not at this time. Seeing a lot of COVID diagnoses, but here in Chicago, similar to across the U.S., both COVID hospitalizations and deaths are at or near all-time pandemic lows. So what does this mean? Please, while we're at high and sort of on this border of medium and high, we strongly recommend that you mask indoors, especially if there are folks who are more vulnerable, if you're not sure of vaccination status, but masking is one of the easiest things you can do. And then also get vaccinated and boosted. And I wanted to just highlight again that getting vaccinated is important, but getting boosted definitely gives additional protection. So you can look at this data on the website, but this is Chicago data for COVID-19 hospitalizations. And you see that red line there is showing you how many Chicagoans who are unvaccinated per 100,000 population are being hospitalized, versus in light blue, how many who are vaccinated but not boosted. And then in that darkest blue are people people who are boosted. And we see that booster being about twice as protective, actually. So the biggest protection, getting from the red line to the light blue line, is getting vaccinated. But you get additional protection for these severe outcomes when you get boosted. And we see that same pattern for COVID deaths, especially as people get older. There's some meetings going on right now, and some data was shared that especially people over 70, if they've not had their boosters, they are getting hospitalized above the rates of other age groups. And that's why that second booster is recommended for people over 50. So this is hot off the press today, updated data for variants. Everything is still Omicron. That's true in Chicago, it's true in the Midwest, it's true across the country. But we've seen, again, these sub-variants of Omicron continue to shift very quickly. And notable today is that the BA4 and BA5, which are shown in green here, are now predominant across the Midwest. So the majority of the cases that we're seeing are either BA4 or BA5. And just as a reminder, the BA4, BA5 are more contagious. The reason why you see the pink outpace the purple, the red outpace the pink, the green outpace the red, is that each of those new subvariants is more infectious, more contagious. And with BA4, BA5, we have started to see some examples, even of people who were infected with Omicron early on, starting to occasionally get reinfected with that BA4-5. So the good news is vaccines continue to perform beautifully, especially for preventing severe hospitalization and death. But there's so much transmission that's still going on that we are seeing the virus mutate and change very quickly. If we look across the U.S., again, you see the Midwest in this case is ahead of the Northeast in terms of this BA4-5, but everything is Omicron across the country. And nationally, if you combine BA4 and BA5, that is now the majority variant. COVID-19 vaccines for kids under 5 are here. It's been going really well. You all are always asking me about what happens with my own family, so I wanted to share. This is my youngest nephew who got his first dose of the COVID vaccine. You can see he's sitting with my sister there. He's got his lovey. You know, these little ones are not as excited about getting vaccinated, of course, as the older children are. They don't always fully understand the importance of getting vaccinated and that protects them, especially against severe illness. He was the most interested in which type of Band-Aid he would be getting, and you know, said that as soon as he had the Band-Aid, it didn't hurt anymore. So I just wanted to again show that, you know, the things that I recommend vaccinating the little ones are the same things I recommend for my own family members. Reminder, there are 2 versions of the vaccine that are authorized for children under the age of 5. You have to be at least 6 months old to get a first COVID vaccine, and for the children under 6 months, we it's the same for influenza, for flu vaccines. The immunity for children under 6 months really comes from moms. So one of the reasons we want pregnant women to make sure they're up to date with vaccines, most importantly, is that it protects their own health, given that being pregnant is itself a risk factor for severe COVID outcomes. But also, it gives this indirect protection for the first 6 months to the baby. So 6 months to 4 years, Pfizer has a 3-dose series, and you can see it's 2 doses 3 weeks apart, and then a third, kind of like a booster, at least 2 months later. It's a very small dose, just 1/10 of the adult dose. We're not seeing side effects, not seeing any issues at this point. And then Moderna is actually a 2-shot series at this point for the little ones, 2 doses, 4 weeks apart. This also is a much smaller dose. It's a quarter of the dose of what even the teenagers and the adults are getting. And there are lots and lots of ways for kids under 5 to get vaccinated here in Chicago. Clinics in some cases are offering Pfizer, in some cases are offering Moderna or both. So you can check online or call ahead. We want the first place you check to get vaccinated to be your pediatrician or your family practice doctor. It's always a best practice to have your pediatric provider make sure your child is up to date with vaccines, because they can make sure if there are other health checks that are needed, they can answer your questions. But we know that, for example, my sister that I showed you the picture of, she's traveling right now. She's working out of state and they're not at home where their pediatrician is. And so she ended up going out of state to one of the pharmacies to get my nephew vaccinated. You can go to chicago.gov/under5vax to see more details. We also are hosting our CDPH's family COVID vaccine clinics. We have all the versions of pediatric vaccines. So we have both Pfizer and Moderna for the little ones available. We also have Pfizer first dose, second dose boosters for older children, for adults. We would like nothing more than for you to come in as a family, get the little one vaccinated. But at this point, anybody over the age of 5, unless you first started getting vaccinated in 2021, everybody should have had 3 doses of vaccine by now. And so if you only had 1 or 2, you are overdue for a booster. And just given how quickly we are seeing Omicron continue to spread, I would recommend getting that booster now. And then for people over 50 or with moderate to severe immunocompromise, at this point, we actually you should have had 4 shots, ideally, that second booster. So we had our first family COVID vaccine clinic of this round at Kennedy King College, and we gave out 235 doses, which is good at this point for a vaccination clinic. Almost 200 of them were for kids under 5. So note that we have a lot of these clinics coming up across the city. This coming Saturday will be at Wilbur Wright and Richard J. Daley colleges, and you see that we've got them scheduled 3 different times so that if people are choosing Pfizer or Moderna, they can get all their kids' vaccines done through this route if they would like. And I want to just thank folks who came and got vaccinated and then were sharing really nice messages on social media. I got a bunch of emails and shout outs. We put a lot of effort into making this a welcoming environment for families. We have, coloring and pictures, and we hand out these Vax Kids capes, which some of you may know. So thanks for people who took some of, like, for example, on the left, took some of the marketing that we've been doing and then put their own comments on it. And so, yes, somebody wrote here, I was wildly impressed with how this was run. If you have pals at CDPH, please let them know it was awesome. And let me just say to my team, it was awesome and it is awesome. And you continue to do amazing work rolling out this vaccine, building confidence with so many partners all over the city. I also want to highlight that kids under 5 are eligible for free COVID-19 vaccines through our at-home program. There, too, we are more than happy to vaccinate any age. So any Chicagoan, no questions asked. You don't need to give insurance information. There's no cost. And again, we'd like nothing more than to start vaccinating your little one and get you or anybody else in your family up to date. We can do up to 10 people, and we've got appointments that we'll schedule at your convenience, Saturdays, Sundays, Mondays, and Tuesdays, morning, afternoon, and evening. And just through the end of July, in certain zip codes that are listed there that are still less vaccinated, we do still have $50 gift cards for first and second doses, only for people over the age of 5. And if you want more information, go to chicago.gov/at-home, or as always, our wonderful call center, 312-746-4835. So here's a little bit of data. We started vaccinating children under 5 1 week ago today. We've already had more than 2,000 children under 5 get that first dose of COVID vaccine and have the providers report it in, and we have it recorded. So that's been nice. We haven't seen issues. And in the first week, our top local vaccine providers by location have been at Lurie Children's, no surprise, at Swedish, Coveted Hospital, Weiss Bluth Peds, Children's Healthcare Associates, which are large pediatric practices, along, of course, with CDPH in partnership with MobileVax. About 30% of our youngest children at this point have been vaccinated by a pharmacy. Just so you know, it depends a little bit on which pharmacy how old your child can be. There's in Illinois, pharmacists can vaccinate down to the age of 3. CVS, for example, if you're at one of their minute clinics with extra training, they will often go down to the age of 18 months. But really, under 3, we prefer to have children vaccinated at their pediatric offices. And always that is the best practice. But we've seen about a third of the kids get vaccinated through a pharmacy. So thanks to all our pharmacy partners. And we have seen actually about an even split of Pfizer and Moderna being administered. So that's been interesting to see. Of course, older children only had access to Pfizer for a long time. So we in talking to people, we think that, if they had older siblings get Pfizer and do well with it, they may be choosing Pfizer. We see some people choose Moderna because it's only 2 doses. The data looks really good for both, and I just tell people get the one that you're most easily able to get. Just again, I said this briefly, but if you got vaccinated for COVID in 2021, but you haven't gotten a booster yet, it is time. Everyone age 5 or over should have a vaccine booster at least 5 months after completing their initial vaccine series. And so, there's a little more detail in this. It's 5 months after finishing Pfizer or Moderna. It's technically 2 months after finishing J&J. And then that second booster dose comes 4 months later for anybody over 50 or anybody over 12, moderately or severely immunocompromised. We are not seeing as many people choose to get boosters, and I am concerned about that, especially for people who are older. If you look at this high level across all of Chicago, all ages now that all ages are eligible, 77% of Chicagoans have had at least a first dose of vaccine. About 70% have completed their primary series, but only 37% have completed a booster. And even if you look at people, 70 to 79, only 61% have, and that is concerning to me for sure. And if we look by race ethnicity, we continue to see Asian Chicagoans most likely to be vaccinated, Black Chicagoans least likely to be vaccinated, and that same pattern where we look at booster doses. Just a reminder, if you catch COVID-19, I get a lot of, when I have friends or family who test positive, even if they know this information, it feels different when it's you. So I wanted to just remind you, regardless of your vaccination status, if you are diagnosed with COVID-19, if you have a positive test, whether it's a home test, a PCR, a positive is a positive. Stay home for 5 days. And then if your symptoms are resolving or gone by day 5, you can leave your house, but you must continue to mask while around others for days 6 through 10. That has not changed. I don't expect it to change anytime soon. And then, obviously the basics continue to apply in terms of staying up to date, wearing that mask in indoor settings, getting tested if you have symptoms or known exposures, and then talking to your healthcare provider if there need to be additional precautions. Looking ahead to fall and winter, I'd say this is a topic we get a lot of questions on. We are expecting to see further evolution of the variants. This is the biggest question mark for me. We also are likely to see further waning of immunity. It will have been a year since people, I, for example, will have been a year by this fall since I most recently had gotten a vaccine, and that protection is very good still against severe illness, but we are seeing more breakthrough infections, and we're just not seeing a lot of lasting protection in people who are not vaccinated, who are just counting on prior infections. So likely some further waning immunity, and then always in the fall and winter, increased indoor activity. And so FDA's independent panel of advisors is discussing how to update and reformulate the COVID vaccine to better target the Omicron variants and subvariants. Remember, the vaccine we're using today is the one that was developed for the original version of COVID before we had Alpha or Delta or Omicron, and also discussing which Americans should potentially get the booster. So there's a virtual meeting happening today. So if you just Google FDA, Omicron boosters, virtual meeting, you can watch it. It's live right now if you want to see how the scientists are looking at the data. I expect there will be some decisions made about the vaccine makeup soon, really by early July. And once we know what that guidance looks like, FDA and CDC are weighing in, we would have the timing for a potential fall booster campaign. campaign. I'm guessing that fall booster campaign will come October, possibly November. It takes about 3 months to start producing, distributing, et cetera, doses that have that updated composition. And the issue is that both Pfizer and Moderna, for example, the biggest providers in the US, they've already studied Omicron-specific vaccines, but this has been complicated because these subvariants continue to emerge. Neither company had developed the vaccine specific to BA4, BA5, because that's just emerged in the last few weeks. And so there's this question of when do you sort of draw the line, knowing that it's going to take about 3 months for vaccines to be produced and distributed, but also wanting to make sure it's the best match possible. So there's a lot of research that's happening right now. The safety profile continues to be good. The efficacy against severe outcomes considers to be excellent, thankfully. But those breakthrough infections, you'd like to any vaccine that is a closer match to the variant is going to be more protective there, but the better the match is, the more protective it will be. And again, as I mentioned, especially Americans over 70, in recent months, we've been seeing them get hospitalized at much higher rates than other age groups. Those second boosters are important, but uptake there has been low. And so the panels will also be over the next few weeks discussing, is this booster a recommendation for everybody? Is it for adults? Is it for older adults? And if you want to watch the conversation, that is open to the public. So as always, you can go to chai.gov/COVIDvax or call 312-746-4835 with any questions. If you need help finding treatment, if you need help finding a vaccine, if you need to be connected to care or resources or testing, we want to help get that solved for you. And we continue to staff this 7 days a week. Very quickly, on some non-COVID news, questions that have been coming in, lots of questions about the overturn of Roe v. Wade. And obviously in the city of Chicago, we are very committed to abortion being part of reproductive health services. As you know, in the city and in Illinois, we expect to see a significant influx of travelers coming to the city to be able to get that health care. And so we have already committed some additional funding to support that. There's been a lot of work here in the city and nationally. And I wanted to just point out that health departments across the country really are aligned on this. Chicago is a member of something called the Big Cities Health Coalition. These are the largest cities across the U.S. I'm actually the vice chair at the moment of the Big Cities Health Coalition. And there's a statement that I would point you to online if you want to get a sense that's showing some of the data on this, showing, there's links to an article from the American Journal of Preventive Medicine showing that women, and in particular Black women who live in states that have historically had more restrictive reproductive rights policies, they have poorer birth outcomes, higher rates of low birth weight babies, et cetera. And there's another study that, being denied an abortion does result in poor financial, family, and health outcomes for the woman. And so I refer you to that, but I wanted to just point out this is a relatively easy thing politically for the Chicago Department of Public Health to sign on. But if you look, we've got the city of El Paso, we've got Austin Public Health, Houston, some of the other health departments across states that no longer consider this a right. The health departments are saying, we still support this and we will be working together as public health partners to make sure that we treat this as health care. So I've been pleased to see the courage and collaboration across the country. And I want to thank my fellow big city health commissioners, especially in parts of the country where this is now a more controversial stance. Also, just briefly on monkeypox. Monkeypox is not COVID. It is spread through close contact, especially touching someone's rashes or sores, potentially sharing bedding or towels. People get often fever and then rash and these unusual sores. We are not seeing at this point people spreading monkeypox without having rashes or symptoms, so that makes it very different from COVID, happily. And we are up to, as of yesterday, there have been 42 Chicagoans diagnosed with monkeypox. We got a couple questions yesterday. Why is that number looking different than what CDC is formally reporting? And this is because there's a couple of levels of testing. There's orthopox testing, which means we have a test that is positive for something in the family of orthopox. And I will tell you that is basically 100% that it will be monkeypox, but CDC does some confirmatory testing, et cetera. So my assumption is that CDC, by the time they're reporting out how many are seeing from states, they've not only gotten that preliminary orthopox result that we can do in the state, but at the CDC, they've done the confirmatory, and we know it's not just orthopox, but it's monkeypox. But 100% of them have been and will continue to be monkeypox, and we act on the orthopox diagnosis. There is treatment available. There is vaccine for high-risk individuals. And again, the health department has been working hard to make sure people are able to access that. Most of our cases, but not all, in Chicago have been seen in gay, bisexual, or men who have sex with men, similar to what we've seen across the U.S. and across Europe. A lot of this is because spread occurs through these tight-knit social networks, and especially through intimate contact. So if you have a new or explained rash, go see a doctor, visit a healthcare provider. If you don't have one, give us a call, our same number, 312-746-4835. We'll work on getting you connected. And then avoid sex or being intimate with anyone until you've been checked out. It's rare. It doesn't spread easily without close contact. Although anyone can be infected, I just want to reassure people that based on everything we know now, this is not something that we are seeing spread through casual interaction. It really does need some prolonged face-to-face or intimate contact based on everything that we know now. It is nowhere near as contagious as Ebola, for example, is, which is the other sort of recent emerging disease that people think of if they're not thinking of COVID. So I just want to reassure you that your risk at this point does remain relatively low, but it's important if people are developing symptoms or these rashes to get checked out. Know that we can treat, we can vaccinate contacts, and even others who are at high risk, and we've been working to do that. So see your doctor if you have a concern, and we will keep you up to date if there are additional things that we need to know. And let's get into your questions. All right. So, Kathy Vase Ginsburg from Facebook is asking, how do you know when you are no longer contagious after having COVID? If the rapid is still showing positive after the 10 days, how contagious are you? Yeah, good question, Kathy. So first of all, most people are getting tested at this point through these rapid at-home tests. That's what I want you to do. You've got a result right away. You can act on it. And generally, you have to have a certain level of COVID virus in your body for that test to be positive. We say you've got to stay home for the 5 days because typically those first 5 days are when you are the most contagious. But in those days 6 through 10, some people still can be spreading virus. And wearing a mask is important. We don't require people to isolate or quarantine if they're otherwise feeling well. But if you are still getting a positive test after those initial 5 days, at days 6, 7, 8, 9, or even 10, you could still be contagious. That's right. I would say, when we make these recommendations, we know people don't always have the ability to test every day. We are doing what's required on a population level. And generally, if people have, if their symptoms have resolved, they are very unlikely to still be spreading a lot of COVID. But if you still have a positive rapid test, make sure you are wearing a mask. Consider isolating still if you're able to. But that would only be for a rapid test. I want to be clear, PCR tests can stay positive for a very long time after you have recovered from COVID and are no longer contagious, just because they're so sensitive and they can pick up dead COVID virus. So It's always a little bit of the general public health guidance for the population versus the specifics. But what I say to people, if you want to be the most conservative, for example, I've had some family members recently test positive, and as I review the guidance with them, for example, one person tests positive, that person is going to isolate from the rest of the family for those 5 days as much as possible. And there are some children at home, a spouse at home, and they are actually just doing some regular daily testing right now. The kids are completely up to date. Everybody's up to date with vaccines and boosters, and the kids very recently got boosters. So I don't expect that the children especially will test positive. They are not required to quarantine, but they're masking, they're being careful, and they're testing every day right now, just if they're going to go to, their camp activities. So I would say, you're certainly not very contagious if it's 10 days later. If you took Paxlovid, if you had underlying conditions or you were older, we do sometimes see, and I've talked a little bit about this before, people test positive, and then sometimes Paxlovid, the most important thing is it takes down the severe illness, but it may extend a little bit the period that people can test positive. And so, treat a positive as a positive, especially on a home test, is what I would say. But your risk of spreading is quite low after those 10 days. If it's still positive, out of abundance of caution, I would continue certainly to mask, and I would avoid seeing people who are high risk. Sigaflor from Facebook says, who qualifies for COVID medicine? All right, good. So everybody qualifies for COVID vaccine. COVID medicine or treatment, it really actually depends on which treatment. There are oral versions, meaning pills that you can take, and then there are IV treatments that you can take. And so it depends a little bit on the treatment. All adults who are at high risk of developing severe illness are eligible for COVID treatments. So then we say, what does that mean? What it means is if you get diagnosed with COVID, please let your doctor know. I gave the advice to my own family members, although the person who tested positive doesn't really have underlying conditions, is feeling fine. I said, let your doctor know. We want you to let your doctor know if you're positive, partly so they can keep track and take note of it in case you were to get sick later or have issues. But also, we want your doctor to decide whether you should get early treatment. Paxlovid is the most commonly prescribed outpatient treatment at this time. It is the oral pills. You have to take it early after you've been diagnosed. You can't wait a week and then you're feeling really bad to take these treatments. You need them early on, because what the treatments are doing, they don't stop you from getting COVID. You've already gotten COVID, but they stop the virus from copying so much in your body. They stop you from, they significantly cut your risk of getting hospitalized or dying. And so I often say it's this belt and suspenders approach. The belt is getting totally up to date with your vaccines, especially if you're at higher risk. Get those boosters. But then if you do get breakthrough COVID, also, and you've got an underlying condition, or certainly if you're older, I would take that Paxlovid. My own family members, for example, who have had underlying conditions or have been older, if they've had breakthrough COVID, they have taken Paxlovid. And Paxlovid is available to anybody actually over the age of 12 who is at high risk for developing severe illness. But you got to check with your doctor, because there are sometimes contraindications depending what other medications you might be taking or if you have underlying conditions. And these have to be prescribed by a provider because of that. So you can't just walk into a Walgreens or a CVS and buy it over the counter, because your doctor needs to look at what other medicines you're taking and make recommendations for whether you should get treatment. Good question. Julie Bell from Julie Bell from Facebook. Please, when will Moderna 6 to 11 years be available to the public? Literally, nobody seems to know. So Moderna 6 to 11-year-old was recently authorized, as it sounds like you've been paying close attention. And the question is really, so it's now authorized. The question is, how much will CDC be distributing at different points? So I'm going to actually follow up with this with my team, and next time that we're on, I would go to chi.gov/COVIDVax to see if there's some details on that. But just because a vaccine is authorized, as you know, it doesn't mean it's available in every setting. And so there have been a couple different lines of distribution here. There's obviously lines of distribution through the public health department, but we have, for that age group, at this point, really kept the focus on Pfizer administratively. But there are clinical providers as well as pharmacy providers that can get it more directly. So I will take that as a follow-up back and let you know. I actually am not sure where all of the different pieces are on that right up front. Okay. Oh, and I see your comment here about the older kids. Yeah, I don't know the answer to that either. I know that, the health department has not received 6 to 11-year-old Moderna shipped to us. That I know at this point, which means we've not been able to then distribute it. And we are dependent on what the federal government will ship to us. What I don't know for sure, and what I will check on, is whether there are other Chicago providers that have had the opportunity, pharmacies in particular, to get that delivered directly. So we will follow up on that next week. And just a little bit of detail on that. Some other folks are asking, the CDC only signed off on Friday, June 24th for that older vaccine, that Moderna COVID-19 for people ages 6 to 17. And so that was separate from the 5-year-old approval. So it doesn't actually surprise me that we've gotten the vaccine for the kids under 5 first, given that this just came through from CDC on Friday. And that the demand is lower overall for this than it is for the under 5s. It doesn't surprise me yet that distribution has not yet started. So we're not seeing it on vaccines.gov at this point. And so I expect that will become available at least in smaller amounts. But given that the final sign-off was not done at the same time for the under 5s and the 6 to 11s. That's why you haven't been able to get an answer yet. And once we know what the plans are on distribution, we'll bring back any updates next week. Sybil Seif from Facebook. Should I reserve my home COVID test for when I have symptoms, such as a cough and sore throat? That's another really good question. So first of all, if you have symptoms, you should take a home COVID test for sure. If you're having cough, sore throat, cold symptoms, you're just not feeling well, you're tired, you feel off, there is a lot of COVID around, and very often we are seeing people get these relatively mild cases. But even if your case is mild, you can still spread it. We need you to know that you have it if you do, if you need treatment, but also to prevent, to help cut those chains of transmission. So first and foremost, if you have symptoms, definitely. But also, I use my at-home tests for other things. I use them if I find out that someone who I was in contact with, even if it wasn't close contact with, I will take a test just for some peace of mind. If I've traveled, I will often take an extra test. Now, I'm somebody who is out and about a lot in public, and I want to be especially careful around COVID. But if I were going to see somebody, an older relative or somebody who I know is at high risk for a severe outcome, especially if there were someone I cared about who was not up to date with vaccines, I would probably take a test before going to see them, just to give some additional peace of mind there. The moving outside helps, masks help, but at a time when I know there is a lot of COVID in Chicago, and we're right on that medium-high level of COVID risk, I want to make sure that I'm doing what I can to limit that spread. And if you haven't ordered your free COVID test from the federal government, I've gotten a total of, 16 tests at this point, free through the federal government. We'll get you the website. I'll say it in just a second for where you can put in, if you haven't ordered those free tests, please do that. But also, I am insured. I'm able to get free tests, through pharmacies. I also will just buy tests at this point if I need them. They are worth it to me. And the city has the ability to support people who need additional testing resources and may not have resources. Covidtest.gov, thank you, is where you can go to get additional free at-home tests. And please use them. So good question. Pam Petrowski on Facebook. Do we know how long hybrid immunity lasts for people who have received 3 vaccines? So when you say hybrid immunity, I'm not sure if you mean people who have received 3 vaccines and have recovered from COVID. Sometimes people use that term. And the challenge, really, this how long question, the biggest challenge has been the way that these new variants and subvariants continue to emerge because they are more infectious, each new version of it. And that's why we see some more of these breakthrough infections as time has gone on, and why it's important, in my opinion, to get an updated COVID vaccine for this fall, at least for highest risk people, if not everybody. I'm kind of anticipating that adults will probably have a universal recommendation, but we'll see. I'm going to let we'll look at the data, see what the FDA and the CDC think. So generally, the rule has been that if somebody has recovered from COVID, we very rarely see them getting infected again within those first 3 months. We do occasionally see it, but the risk has generally been thought to be lower. I will say with BA.4/5, we are seeing, like I said, a few people, even locally, getting a second version of Omicron if they were infected back in December, January. Now that is more than 3 months later, but that's different. We previously were not seeing reinfections unless it was a different strain, meaning a different variant, Alpha versus Delta versus Omicron. But generally, if you are up to date with all of your boosters, you remain very well protected against any severe outcomes, and you remain about twice as protected as people who are not vaccinated against infection. If you were to get a breakthrough, likely it would be mild. You should get treatment if you're at high risk, etc., because that's what helps make it unlikely to happen. And then us, wearing your mask on the L, being careful, testing, all of these things help limit the chains of transmission, and that in turn decreases the risk for future variants. It also decreases the general risk here in Chicago. And I'm not very worried about this summer. Unless we see some really scary new variant emerge. I'm more concerned about what comes in the fall or winter. Terry Dodd from Facebook. Will a vaccine be available for monkeypox anytime soon in Chicago? Yes. So actually already, monkeypox is an example of a very uncommon disease that Chicago would not historically, nobody would historically keep vaccine on hand for monkeypox. But in what's called the Strategic National Stockpile, which is where the federal government maintains vaccines, monkeypox is in the same family of vaccines as smallpox is. And although this is much more mild than smallpox based on everything we've seen, to my knowledge, there hasn't been a single death, not just in Chicago, but anywhere at this point across the world with this monkeypox outbreak. And most people, they're having pain, they're having symptoms. I don't want to minimize it, but we're not seeing a lot of severe outcomes, and people generally recover. There is vaccine in the Strategic National Stockpile because of the potential threat for smallpox being a weapon of bioterrorism, not that we would ever want to see that. And so there's been quite a lot of conversation. There are 2 versions of the vaccine. There's one there's a lot of it available, but it can have it's a little bit of a more difficult vaccine to give. It's not just one shot, and it can, if people are immunocompromised or there are other contraindications, it's a more complicated vaccine. There's more of that available. There are some doses, thousands of doses, available of the other version of vaccine, which is a much more straightforward 2-dose vaccine. And so given that we have seen a relatively large number of monkeypox cases here in Chicago, just like they have in New York, just like they have in LA, we have received a few thousand doses and have started doing vaccine. We already we're vaccinating close contacts. So for example, if somebody is diagnosed with monkeypox, we're talking to that the health department is talking to that individual, protecting their privacy. You know, who have you had close contact with, and then we're working to make sure those folks of course are getting vaccine. We've been doing that all along. We also, working with partners, have started doing some additional vaccination for people who are at higher risk and may not have all of the information. So for example, people who have had, especially men who have sex with men, given that that's been what our primary epidemiology is, people, for example, who have had multiple partners in the last couple of weeks, or people who have anonymous sex partners. We've been working, obviously it's been Pride, with some of those events to start doing some of that. So there will be more to come there. The biggest question is the amount of vaccine. And, you know, I really am very appreciative of CDC for getting some vaccine here early to Chicago. It's meant that we've been able to vaccinate well around known contacts, and we and others are working on prioritizing and making sure highest risk individuals can access that. Separately, there is treatment available too. So if people are, you know, have severe illness, we are able to get them treatment. All of this, though, is done through your healthcare provider, and then your healthcare provider is in touch with the health department. We make sure testing can happen. We make sure if people need treatment, they can get it. We've worked to even make sure like if we're laboratory workers, maybe working with it to get them a little bit of prophylactic protection. So there's a number of pieces that are happening, but yeah, Chicago is ahead of a lot of the country in terms of having some of this available. And the scale of the campaign is really going to depend on some of these larger national decisions about how much vaccine and whether we end up using both types of vaccine or not. But yes, we are already vaccinating thanks to multiple partners, Rush, UIC, Howard Brown, the CDPH folks, who have been really helpful in terms of getting a lot of that set up and the ability for us to do some mobile work there too. Next week, on Tuesday, when we're doing Facebook, I am planning to bring Dr. Jana Cairns on. She is one of our medical directors, and she's actually leading on a lot of the monkeypox work here in Chicago. So knowing that we continue to have a lot of interest and questions in it, I thought you would appreciate having an expert on. So she'll be joining me next week. So if you've got additional monkeypox questions, we'll also have more of a sense, I think, of nationally what we might be looking at in terms of some more vaccine strategy by then. All right, and just as a final, Brad Helios from Facebook says, what about the fentanyl overdoses? Stop with the stupid COVID, that scam is up. So Brad, you know, I hear you on not being excited about talking about COVID. COVID is obviously not a scam. It has killed more than 7,000 people in the US, but we are doing a ton of work on fentanyl overdoses. And actually, if you're interested, if we've got a little bit of time on Tuesday, we'll see sort of, you know, what else is going on and what questions come in. But I would be very happy. We have talked on Facebook Live before about some of our work with substance use disorder and opioids, but I'm happy if we've got a little bit of time either next Tuesday or the week after to talk some more about that, because Chicago is doing a lot of really important, I think, innovative work in this space, and there's a lot more to do. So thanks for raising that concern. It's just about time. I do see Sybil Seif's question from Facebook. What about the risk for long-term COVID in middle-aged adults? So the good news is that we are seeing many fewer people develop long COVID now than we were earlier in COVID. We think that's a combination of especially people being vaccinated combined with Omicron itself seems probably to be a little bit less likely for folks to develop long COVID. That said, I wish we had a test that would tell us, you know, you are at high risk for developing long COVID, you are not, because there are people who do continue to develop long COVID. It's one of the biggest reasons why we say, please don't say, oh, I want to get COVID to get it over with. I sometimes hear, you know, people ask me that. Shouldn't I just get it? You know, I want to go on vacation later. I want to have additional protection. We don't have any evidence that getting COVID protects you in a long-term way. The vaccine is really the more important in terms of longer lasting protection, especially against severe illness. So it's not helping you in a long-term way. And you are having the risk not only of spreading it to others, but potentially of long COVID. And so I would say, you know, at this point, it is not a high risk for developing long COVID, but the risk is also not zero. And I wish I could tell you on an individual level what that risk was. There's a lot of research happening here in Chicago, around the country. It's one of the main focuses of CDC to really understand more about long COVID. And I know it's something people worry about, and I know there are Chicagoans who continue to have effects. One thing I will say is a surprise for me, and I think for the scientific community, is when vaccines first came out, like way back at the beginning, we saw some people who had long COVID, right, who got COVID before a vaccine was available. They got vaccinated and actually saw a resolution or significant improvement in their COVID symptoms, which was this clue for researchers. You know, we know it has something to do with your immune system just not responding appropriately. And so there is some hope that if there is an updated vaccine in the fall that's a better match, we might see something similar where people are getting a vaccine to some of the variants that have come since. Perhaps we would see some people with improvements if they are later had infections or later had long COVID. So I would say, you know, most people that we are seeing, especially if they're vaccinated and up to date and don't have a lot of underlying conditions, most people are getting pretty mild breakthrough cases, and we're not seeing a lot of that turn into long COVID, but it is not a zero risk, and I want to be honest about that. Oh, I'm sorry. Yeah, quick. Somebody noted here. I apparently misspoke and said 7,000 people died in the U.S. More than 7,000 people died in Chicago. More than 1 million people died in the U.S. From COVID, which is remarkable. So thank you for the person who helped me correct that. These numbers are big everywhere, and for people who still think that COVID is a scam or is fake or it's just like the flu, you know, unfortunately, our COVID death rates continue to be, you know, you look back 10 times what a flu season shows up like. So we continue to have more tools every few months between vaccines, hopefully updated vaccines coming, treatments, and diagnostics. But I don't think COVID is going to be completely over anytime soon. And it's important that we are minimizing the risk and continuing to evolve. It does not need to control our lives. I agree with you on that. I don't see us having to move towards shutdowns or the major disruptions unless, in a worst case scenario, there was a new variant that the vaccine was not effective against. But I don't anticipate that, certainly in the short term. But it does mean doing what we can, especially when levels are high, to minimize that risk without having it control our lives and with doing the things that we all love about Chicago, especially in the summer. All right. Thank you so much for your attention. Again, we will be back next Tuesday, July 5, with confirmed guest Dr. Jana Cairns from the Health Department. We also will do some follow-up on that Moderna 6 to 11 for Julie Bell and others who may be curious. And if we have time, if not next week, the week after, we'll do a little bit about substance use and overdose. And then I also just wanted to note for anybody who's interested, today at 1 p.m., I'm going to be down with Blue Cross Blue Shield Illinois at one of their new Blue Door clinics, all the way down in Morgan Park, far south. And Blue Cross Blue Shield has opened 3 of these neighborhood-based sort of health clinic centers that are open to everybody, even folks who do not have Blue Cross Blue Shield insurance, and really filling some important gaps there on the south side where we still have not as much resources. And they're doing COVID vaccines, including for the little ones. So we'll be doing a little bit of a press conference and some and lifting some of that up. But again, at this point, nice to see additional investments from many, many partners. So with that, I will sign off. I wish you an excellent week, and in fact, a long 4th of July celebration. Please celebrate Independence Day out of doors if you can. Do some testing if you can ahead of traveling, but treat it as a celebration, because we do continue to be in really quite a good place from a COVID perspective. Thanks so much.